Hi, this is Lawrence Stock, and I'm submitting to Session Board 3. For this week, I reviewed Microsoft Health Vault. It is a digital application. Its purpose is for tracking fitness, nutrition, treatment plans. You can track conditions and research medical and health issues. The pros are it is highly versatile. You can track everything from allergies to lab results, BMI, blood pressure, physician input, your medications, steps walked, exercise regimens, health articles. The cons, there is a fair amount of privacy information that you share. The information page on the policy is Microsoft is not responsible for the privacy activities or protection sharing, and they do have advertising ID contracts to share your information with third parties. Another con is that you can't do data overlays of different aspects of your fitness to compare items and see how they might interrelate. The benefit is for pretty much anyone. It focuses more on physiological issues as opposed to mental health, but you can track medical treatment plans as well as medication, so it works for just about everything. The other application is Workouts Trainer by Skimble for nutrition, fitness. Highly terrible are the pros. Not a lot of personalized information is a pro and a con. It has posting boards. You can do team workouts, set schedules. It even has handicap options for some of the fitness regimens. The benefit, it works for anyone from novice to expert looking to get fit, to tailor it through just about every type of exercise that there is. So from the readings that we had, I noticed from Anthony Goldblum's TED Talk that he was talking about the empowerment that can come from the different aspects of technology. As more and more patients and more medical and health systems are utilizing system tracking to do a lot of the sorting for data, people feel more like numbers. And so, as per the Chaco article in Chapter 8, people are able, the result from a lot of the system automation in the medical field, where people are being treated more like numbers, and we still have folks that remember a lot more specialized treatment that came in the days before the major medical systems and databases and evaluations, where they're now able to use these applications to monitor and empower themselves to track their own health. This speaks to the Chaco article where he's talking about a way where the macro and micro levels influence and create one another. So you have these applications that are keeping your personal data, and you're able to tailor and alter them. And yet, as we also had in the Module 6 lecture, where a reference to Steinbook, where we have personal control online, and yet there's not the same type of protections. Well, for the Health Vault, it also conforms with European Union Regulation 2016-679 for health information. So in the U.S., it doesn't conform to HIPAA in some of the articles that we read, but it is still receiving the protections for personal identifiable information. So the need for greater care that isn't being received in these new automated systems that minimize the amount of time spent with physicians and do more machine diagnosis. That obviated the need for these applications for people to empower themselves for greater health and fitness tracking. And yet, because all the privacy information is out there now, it obviated regulations, as we see with the EU regarding personal information. So it's kind of this cycle of continual advance and development.